We continue with part 2 of Psychiatry and Law. How are they related?
Now, as we concluded in the last half hour, it seemed to me that there were two major issues that we were talking about on which perhaps we ought to continue. The first deals with what we in the law talk about as the issue of criminal responsibility, namely the responsibility of a person to the law for the acts that he has committed. The second issue that I think we ought to address ourselves to is the way in which our system deals with people after a judicial adjudication has been made, either that they are offenders and criminals or that they've been acquitted and it's been decided that they're not guilty, but in fact they have some condition for which treatment is called for. Now, turning to the first issue, I think that there's been an enormous amount of controversy about the various tests for insanity. I think that these tests, whether appropriately formulated or not, reflect four basic functions of the criminal law. One of these is to deter others from committing crime. The second is to rehabilitate persons who have committed crime. A third is to incapacitate persons who have committed crime so that they can't go out and commit further crime. And then finally, a fourth is the retribution or revenge function, which still exists, although most people would like to think of it as absent from our criminal system. Now, it seems to me that the psychiatrist has a role in at least three of these four functions or objectives of the criminal law. Certainly, he can help determine whether the particular offender was deterrable or was not deterrable, and perhaps a social judgment can be made whether acquitting him by reason of insanity would have any impact on the general deterrence of others by reason of the fact that he seemed to get away with it, if we'll put that in quotes. In the rehabilitative function, of course, the psychiatrist has a very important role. In the incapacitation function, it seems to me there too the psychiatrist has a role, because in effect what the psychiatrist is asked for is to make a prediction as to whether this person who has committed this offense is likely to commit it again. Should he be incapacitated for the rest of his life because he's too dangerous to release to society? And it seems to me that psychiatrists are asked to make that judgment over and over again. Now, in any event, and without spending too much time on it, psychiatrists have found over a period of time that these objectives, which everybody agrees about, are not adequately articulated in terms of legal tests, whatever these tests may be, so that the psychiatrists are asked to testify to what in effect are legal fictions. There's enormous dissatisfaction about the way the law has presented itself to psychiatrists. Now, on that assumption, there is a trend away from concentration on the legal test for insanity or determining whether a person is responsible or the extent of his responsibility. And now there is a great trend toward considering the role of the psychiatrist in what we'll call the dispositional stage or dispositional process of the criminal law. We've determined either that the accused person is guilty or that he is not guilty, but something has to be done with him. That is to say, he either goes to prison or he is sent to a mental hospital. And psychiatrists are now concentrating on what the role is of the psychiatrist in that situation. Bernie, what do you think is the appropriate role of the psychiatrist?
Well, I certainly agree with you that it's a dissipation of important resources to limit the psychiatrist to just such issues as insanity or responsibility. Those issues, particularly when psychiatry is used to establish an individual is not responsible, in a way takes the offender out from the whole system of criminal justice and exposes him to, I think, very particular abuses. And in some sense, exposes him to the possibility of very gross violations of his civil liberties. But you can't entirely separate the issues of criminal responsibility and insanity, particularly diminished capacity, from the issue of rehabilitation, because the law's determination of guilt and responsibility places very important limitations upon the rehabilitation and treatment prospects in relationship to sentencing. If a man is sentenced to die on the gallows, it's rather futile to speak of his rehabilitation. But assuming that an individual is going to be sent to prison and that there are certain options available to society in dealing with that person, then I think the psychiatrist has, again, certain kinds of important information which have a bearing on the way the society should deal with that offender. So that if the man is not going to be confined to the rest of his life, or he's not going to be executed, then the issue that the criminal law must deal with is what procedures from now on offer the best possibilities of restoring to society at the earliest possible time an individual who is safe for society and who is no longer disposed to the commission of crimes. Now, it would be terribly naive to suppose that psychiatrists have the final answer to this issue. But we do have some information about what motivates people, what causes recidivism, and particularly the psychiatrist has a lot of information as to what qualities of institutionalization and prisons and punishments can be very damaging to people and can enhance the tendency to recidivism rather than aid in the reform. So that a psychiatrist can be utilized not only to decide such or to help in the decision making as to how long a person should spend in an institution before he can be released, but also he has a lot to say about what the character of those institutions should be, what kind of activities there should be, whether there should be treatment programs and what kinds of treatment programs and the like. And so that I really do believe that in relationship to sentencing, in relationship to determination as to how long an individual should remain in an institution, at what point is he ready to be restored to society, what is the likelihood of him getting in difficulty at all. Again, psychiatry has certain kinds of information which should be valuable to the decision makers. I do not at all believe that the psychiatrist should be the decision maker here. Here I support the idea that those authorized groups in society like judges and adult authorities, parole boards and so forth should make these decisions.
Well, now all of this, Tom, sounds very good if we assume that the psychiatrists in good faith are using a certain amount, a substantial amount of expertise, that they have research findings, that they understand the personality problems of offenders, that they have case histories, that they have checked out their results over a period of time, they've made longitudinal studies, they have some confidence that the recommendations that they make as to predictions of what this person will and will not do are reasonably reliable, accurate, valid. If indeed this is so, then I don't think we could escape the value of all of this. Do you agree that this is so?
Well, Alex, as you know, that opens up a tremendous, large area, and suffice it to say for me here that I don't think this is so. This is all a self-definition of doing good, which perhaps can be analogized to the Inquisition, which after all was very important. I'm not using the term pejoratively, I'm referring historically to the Inquisition. It's a very important aspect of Western Christianity for 4 centuries, in which inquisitorial interventions were after all defined and authenticated and accepted in society as good. Obviously the victims did not share this judgment. Now, similarly, we must ask here, who is to define whether these things are good? The defendant, the prisoner, or the psychiatrist, or society? Let me make my point clear, perhaps on an example. When I hear this kind of description of what psychiatry does in the courtroom, I'm struck by the fact that how much it technicalizes and medicalizes what are overwhelmingly moral problems. For example, Mrs. Margaret Sanger was a nurse, went to jail in the early 1900s in New York City for teaching women how to use birth control. Now what does it mean? Let's assume that she's now in jail. What does it mean to rehabilitate her? She should give up her idea that birth control is a good thing, that a woman should have a right to birth control? Gandhi was in jail. Bertrand Russell was in jail. What does it mean to rehabilitate these people? Now, I'm not romanticizing crime. This is not to be equated with my approving of criminal activity. But a great deal of crime is a moral, social, human protest. And the question is, what are we doing? Are we trying to enhance the dignity of this individual, or are we trying to diminish his dignity? I think psychiatry is very effective in diminishing his dignity and enhancing the dignity of everybody else who is outside of jail. Well, I don't think we should confuse these two things.
All right, so you're posing the issue of dignity on one hand and non-stigmatization of the offender as crazy as against what Dr. Diamond...
Less than human, misguided.
Yeah,
He has to be he's stupid.
I would concede the point that psychiatry, like the criminal law and like any social institution, can impose upon people labels which are nothing but really degradation ceremonies. And to say that a person is crazy, to say that he's schizophrenic, to say that he's insane, is certainly a way, or can be a way, of degrading him, and in many instances, in fact all instances, is probably regarded by the recipient of that label as a more degrading designation than to be considered a convict. But it doesn't have to be that way. The fact that psychiatry and the criminal law are capable of the grossest abuses and misuses, again, doesn't mean that we should abandon these institutions. A diagnosis can be a label. It can be what I've called an instrument of social action, so that you use a diagnosis to put somebody away and deprive him of his constitutional rights. But a diagnosis can also be a very revealing and very helpful way of communicating information to others and to the individual himself. Now, I think that a psychiatrist who is involved in the legal system is perfectly able, in most instances, not infallibly, but in most instances, to distinguish between the Margaret Sangers and the young men who are in prison because of draft evasion and the like, and to refrain from applying to them degrading labels. At the same time, the psychiatrist is able to deal with another type of prisoner who I think is much more common than the Margaret Sangers. And these are very, very confused persons who have been victimized by continuous sets of social situations, psychological disorders, incapacities of all kinds which have made them kind of the victims of society rather than the protesters. And I think in these individuals, who I regard oftentimes as sick, can receive a great deal of understanding and help, which makes it possible for them to be restored back to society at a much earlier time and much less damaged than if the naked revenge, retributive, punitive aspects of the criminal law are applied to them.
Alex, if I may, I'd like to ask a question. Bernie, you said that they can receive help. Really, our disagreement hinges on who defines help. Now, in that sentence, who is the one who is defining help? The psychiatrist or the offender?
I think this varies. I think in the most desirable situation, one defines help in terms of the view of the defendant. and of the patient. And I certainly would take pride in the fact that I have successfully treated criminal offenders and obtained their release, and this was with the full consent and full desire, and I might say the gratitude of the particular individuals concerned. There are very special and I think somewhat unusual instances when a individual himself is not always the best judge of what should happen to him. I don't think, for example, you are doing any favor to a person who has been institutionalized in either a prison or a hospital if you let him out and it is inevitable that he's going to go out and kill somebody. I don't think you're doing any favor to a person to allow him to commit suicide.
Well, but
I know that you and I have a very fundamental disagreement about this point, that you feel that people should be entirely self-determinative.
No. You see, you are attributing, excuse me, you're attributing now general views to me about, I was trying to focus it on who determines whether something is helpful, which is ascertainable by whether or not the defendant or the prisoner asks to see a psychiatrist, asks to go to a hospital, or whether it's a judge or his lawyer or the prosecutor who asks for it.
Well, I think that society sometimes has to make that determination.
But you are making now a moral judgment, which is fine. I am trying to focus on how things are and simply makes a statement that it is my view that when this is done against the expressed desires of the individual, then this is degrading to him.
Of course, I think it could be said that even if it's with his consent, and I would agree with both of you that the issue of consent may be an important one, a lot of psychiatrists who have studied the uses of psychiatry in the prison system, as well as in mental hospitals for the criminal offender, take the view that there's an awful lot of hypocrisy involved in it, a lot of dishonesty, that a lot of criminal offenders use the psychiatrist as a vehicle for achieving earlier release. And I think I'm right in saying that there's a great deal of dissatisfaction with the treatment function of the psychiatrist in a prison setting that is essentially punitive.
Well, it's very, very difficult for a professional person to work in a prison setting because most prison settings are very, very destructive rather than constructive to the individual. The prison itself is often set up in a very specific way to systematically degrade the individual, and this is one of the reasons why prisons don't ordinarily contribute to the rehabilitation of an individual or his reform, but actually contributes to the likelihood that he will repeat his offense. And I think it's quite possible for a psychiatrist in such a setting to become simply an instrument of society's punitive revenge. And so psychiatrists can and have in the past, in many instances, I think, abused their medical privileges and left or distorted their role as a healer in order to do many, many things which I regard as very evil. But it doesn't have to be that way. I think an institution or the disposition of the criminal offender can be done from the very start with his rehabilitation in mind. Now, I don't think there is any place in the United States today where this is done to a really very satisfactory degree. But I think that in some places it's better than others. I think in the state of California, very strong efforts are made to minimize the harm that a prison does to individuals and to facilitate his rehabilitation. And the prison psychiatrist plays a role in not only the treatment of the individual, but also in structuring the atmosphere in which that prison exists.
Yeah, yes, but Bernie, isn't it true that a large number of important policies are adopted in various states on the assumption that psychiatric expertise and psychiatric resources are available for this very liberal kind of treatment that you're talking about, when in fact the skill and the expertise may not be there, the resources are not there in the sense that the prisons find it difficult, if not impossible, to get enough psychiatrists to go to work. The jobs in prison systems are very unattractive, frequently filled with hacks, and I think it's one thing to say that a very gifted and dedicated psychiatrist can achieve a certain amount of good, and to then try to establish a model based on the existence of such relatively unique individuals, which then involve great civil liberties dangers that I think Dr. Szasz is concerned about, namely the indeterminate sentence and the like, in which there is no uniformity of treatment, and in which, in fact, prisoners may often remain in an institution for a very, very long period of time without adequate treatment. Should we, in other words, look very skeptically at the kinds of models that we're talking about in the criminal justice system, when the assumptions on which these models are built are assumptions which in reality and practicality are false? We don't have the expertise, perhaps. We don't have the people. We just can't do what ideally we'd like to do, and therefore we ought to revise our notions of what the system should consist of.
Well, I would prefer to deal with that issue in this way. Granted that everything you've said is correct. Nevertheless, I think it's of great importance for that at least some institutions should be set up to serve as models, as pilots programs, to demonstrate what can be done under favorable circumstances so that standards can be set. I think that this treatment can be accomplished with full respect for the civil liberties and constitutional rights. I don't agree with you at all that the indeterminate sentence in any way violates the constitutional rights of an individual. I think it's completely a myth, the idea that each crime has a defined punishment, a price tag attached to it. I think the courts have always tended to hold that the indeterminate sentence concept is constitutional. The problem is, if there is an indeterminate sentence, who makes the decisions and what kind of information is utilized in order to decide when the sentence is terminated? Under bad situations, people who shouldn't be making the decisions, namely doctors, make the decision, and all kinds of information is used which should not be used. But it doesn't have to be that way. I think that there are circumstances in my own state of California, I think in England, and in many European countries, particularly Denmark, it's been demonstrated that the indeterminate sentence and the use of behavioral science information can be a most valuable tool, not to restrain people and not to degrade them, but actually to humanize them and to facilitate their restoration back to society.
Have you a comment on that, Tom?
Well, this is, I have a lot of comments on this, Alex. I think it's necessary that we state, I would prefer to state more clearly my own moral values rather than sort of imply them through policy decisions, as Bernie does. It is my judgment, quite frankly, that the indeterminate sentence is more immoral, is a greater moral evil than the death penalty. First of all, this is my view. Secondly, I also think it's a moral evil to speak in a blanket kind of way about restoring people to society. Again, let me take Mrs. Sanger or Bertrand Russell. What does it mean to restore them to society? That they can be held until they promise that they will not, that they no longer believe in the beneficial value of birth control? We have to deal with this concrete situation.
You're assuming that a psychiatrist makes only kind of one way.
No, I don't care who makes it.
Well, wait a minute. Or society or prisons or other people make only one-way decisions. Isn't it possible for a psychiatrist or an adult authority or a parole board to decide that, irrespective of the legal position, that Margaret Sanger's views on birth control do not represent psychopathology, that they do not represent deviance, but maybe represent genius?
But if they don't
maybe
represent...
these are desirable ways, and to facilitate the return to society of people like these, so that they can carry on their good work.
Well, in fact, I think we'd have to agree that these are relatively unique cases and idiosyncratic cases, and that we're talking about the uses of psychiatry in the criminal justice system mainly for those who are burglars, who are armed robbers, who are persons who have committed homicide. As a matter of fact, it's mainly with the more serious crimes like homicide that psychiatry has been concerned. And I think it would make more sense to talk about whether, not the Margaret Sanger type illustration, but whether psychiatry has much to offer in connection with these routine garden variety crimes.
Well, I think it can be demonstrated really quite accurately with figures that under the indeterminate system, sentence system, that the offenders generally are restored or given their liberty sooner than they would be given under a fixed sentence
So it's a
system.
mitigating situation, even though
Sure.
occasionally someone remains for a longer period of
Yeah.
time and feels
But the
unjustly
purpose
treated.
is not to extend their imprisonment, but is to reduce their imprisonment. I think the purpose of the psychiatrist in the prison is not to hold people in confinement. The purpose of a psychiatrist is to facilitate the release of people. Now, it's true that some psychiatrists have envisioned their role as watchdogs of society. They are agents of punitive authority. I assure you I have the same contempt for these colleagues of mine as you do, that I disagree very strongly in such uses, and that every possible legal and medical and ethical precaution should be exerted to stop that sort of thing. But that doesn't mean that the whole instrument of psychiatry, of psychology, of sociology should be just thrown away because there have been some abuses.
I think we have just a few
Well, I
moments
can
left,
say in 10
Tom.
seconds, I am not implying that psychiatry should be thrown away. I am only implying that psychiatry should never be used involuntarily.
This, of course, is an enormously complicated subject. Dr. Diamond spends 15 weeks of a semester teaching a seminar on the subject. I do. Myself, we spend 30 hours talking about the issues we've tried to cover in 1 hour. And Dr. Szasz has written extensively on the subject. What we've tried to do here is not resolve anything, of course. It would be impossible, but mainly to illuminate issues, to explore issues, to suggest what the different points of view are on these issues, and I hope we've been helpful to you in doing that.
We thank Dr. Thomas Szasz, Professor Alexander Brooks, and Dr. Bernard Diamond for their interesting analysis of a critical problem in patient care. In subsequent programs, we shall continue to record significant concepts and controversies in modern medicine. The opinions expressed on this program do not necessarily constitute endorsement by the Department of Health, Education, and Welfare, the Public Health Service, or its constituents.